Welcome, Citrus County, and the doctors are in. I'm Krista. Let's see who's in the studio today.
I'm Dr. Stephen Kaufman. I went to college at the University of Florida. I did my podiatric medical school in Chicago and my surgery training in Miami. I've been in Citrus County since 1998 and currently with Citrus Orthopedic and Joint Institute. As a podiatrist, I treat the foot and ankle.
Well, Dr. Kaufman, welcome to the show. And we've seen other shows with other specialists and doctors, and I know you have a specialty of podiatry. So
Yes.
Why don't you tell us about it?
Well, first, Krista, thanks for having me here. I'm a podiatrist. A podiatrist is someone who treats the foot or the foot and ankle. We do a lot of things for the foot and ankle. Sometimes it's getting you improved from an injury or an infection and getting you back to high performance. Sometimes it's perhaps correcting a problem that you've had for a long time and getting you back to work. Or sometimes, especially in our community, it's as simple as helping you cope with some of your symptoms and make them a little less painful so you can get around and shop and take care of your family.
Well, it's awful when you can't wear a shoe or do your exercising or whatever, but why'd you get into this?
That's a good question. I've been asked that more than I thought I would. Yes. Well, there comes a time in everyone's training when they have to decide what they want to do. And I did spend time at the University of Florida and Shands volunteering. I knew I was interested in medicine, interested in surgery. But I spent some time in doctors' offices, and there was a particular doctor in South Florida kind of mentored me. And I saw what he did. And I liked the fact that he could use a high level of training to perhaps fix an injury, but he also had some people that he would see over and over again and bring their family and bring friends, and it was satisfying to be able to follow him through the years. That's part of what brought us to Citrus County. It has a very similar feel to the county I grew up in, South Florida, and it's a great place to raise a family. I have a son in middle school and a daughter in elementary school, and we really feel like we're part of the community.
Well, and it's great to help people but get back to their lives, you know, that they didn't have.
Yep, back on your feet again.
Yeah, exactly. And so do you just do foot surgery?
Foot surgery, no. Surgery is actually a small part of what I do as a podiatrist. I am trained to do surgery. I'm board certified in both foot surgery and separate certification in what we call reconstructive foot and ankle surgery. But when a patient comes with a problem, it's usually not a surgical problem. Most of the things I see from the toe to the heel and even into the ankle are really don't require surgery. They require treatment, but most things we do with therapy or other things to get you better. But when it does need surgery, when it's something more serious, we can certainly provide all the different types of surgery you might need to fix your problem.
Well, do people wait really a long time before they see you, or do they call themselves into the office and want to be seen, or does their primary care guy send them to you?
It depends on the injury. It's just the nature of an orthopedic practice that we do see a lot of trauma. Some things need to be seen right away. I do see patients at both of the hospitals with fractures that, of course, need to be attended to right away. But most conditions are things that have affected them most of their lives, and it's finally just gotten to the point where they or their spouse says, you got to do something about it. And those things are the things we spend a lot of time evaluating, trying to find the root cause of the problem, and give them options on how to make it better or fix it.
So when you're working with the patients and finding the right treatment, how do you come up with the treatment program that they should be doing? Or
the treatment program we do discuss thoroughly, and we do offer a wide variety of treatments. And we're going to talk about some of those today. I'm glad to share some of those. But I'd like to back up just a little bit and talk about something equally as important, which is getting an accurate diagnosis.
Well, that's important to me, especially if I'm hurting.
I have had patients that have had the wrong diagnosis, and then they've gone through a series of treatments, and it just hasn't gotten better. It's because they haven't really maybe found the root cause of the diagnosis.
So they see other doctors before you, and they're misdiagnosed?
Well, not misdiagnosed, maybe underdiagnosed, or perhaps it's from someone who's not a specialist in that area, and they could be along the right track. Many of the things that we see in the foot are often called arthritis in general, but when we look specifically, perhaps it's not arthritis, perhaps it's a nerve condition, perhaps it's a certain form of arthritis or deformity that's causing the arthritis. So,
well, it just seems like everyone uses the word arthritis, and
yes,
really,
it is used a lot, and there are different forms of arthritis, of course, and different severities, and that's why we try to give everyone their options and show them what we can do. But you did mention treatment.
Yes, treatment.
Treatment, and the accurate diagnosis is actually more important initially.
Well, I mean, that's what I came to you for, and I would like that, definitely. Can you show me an example of something that maybe have been misdiagnosed or isn't very clear, or how do you go about doing that? Or
many of the things we see are obvious, broken bones, or you can see deformities in the foot and ankle, but some of the conditions in the nerves are more vague. They don't show up on X-ray. There aren't simple tests for them. There's different neuropathies or nerve damage, and sometimes we just don't know the source for them. There's a condition people know about carpal tunnel in the wrist, but there's an equivalent in the foot called tarsal tunnel.
Tarsal tunnel?
Tarsal tunnel,
oh, wow.
which can give you numbness and burning in the bottom of the foot, and it's not necessarily neuropathy. It's actually an impinged nerve. But by far the most common nerve condition that we see is Morton's neuroma. Morton's neuroma, and I've got some samples here to share with you.
Oh, great.
It's a nerve condition at the base of the toe. Here we see a Morton's neuroma patient will typically come in complaining of a pain that's more of a numb pain or a full pain, like a lump in their sock, sometimes radiating to the toes. This graphic shows you that it's usually in the central toes, between either the middle toe and the next toe, or between these two toes. They might have a burning or a sensation of a lump here. When we feel on physical exam, what we're checking for is if that nerve's enlarged and painful. It's normal to have a nerve that comes between these bones, called the metatarsals, and divides into a Y when you get to the tips of the toes to give you the feeling between your toes.
Wow.
If, however, that nerve becomes irritated, rubbed, squeezed, and trapped, it can get inflamed and larger. Initially, it'll only happen slowly, but can slowly get worse and more frequent, to the point where the inflammation stays there and you get a permanent thickening in the nerve, and that's when we have to start offering treatment.
Well, that's something I don't want. It probably takes a while to get better.
Yes.
But we'll be back with Dr. Kaufman for some more treatment and diagnosis ideas, as well as some video he has of how he takes care of the patients and examines them.